going home after a spell of medical care or treatment should come as a relief. But a damning new report exposes how, for many patients, leaving hospital is a harrowing ordeal. Pam Waller had dementia and was partly paralysed. Yet in the last months of her life, she was repeatedly discharged home without her daughter being informed, even though it was obvious she couldn't cope.
The ambulance men actually said to me on more than one occasion, I should be taking your mum into hospital, not home. She couldn't walk, he'd carry her in and she'd sit there on her own, couldn't take herself to the toilet, couldn't get herself anything to eat, and that's how she was left. I thought I let her down. Sorry, I still do.
The Health Service Ombudsman has released details of several other shocking cases she's investigated, including a woman in her late 90s, not properly examined before discharge, who died in her granddaughter's arms moments after she got home. An 84-year-old discharged against her consultant's instructions in a confused state, still with a catheter inserted. And an 85-year-old woman with dementia discharged at 11 p.m. to an empty home with no food, drink or bedding.
This is despite 10 years of good guidance being in place. So what we're asking is that government look at why is it, after 10 years of that guidance being in place, that we are still seeing not just a steady stream of these bad cases, but actually that they're going up.
The Department of Health says this report shows unacceptable failings in care and some patients have been terribly let down, so it's vital that we ensure lessons are learnt. We expect the NHS to ensure patient safety and social care needs are taken into account when making clinical decisions about discharging patients from hospital.
If you go home somewhere and there's no support, then the chances are that you won't make that good recovery, and that may be your chance gone of retaining your independence. So the consequences for older people when it goes wrong are really very serious.
Cuts to social care budgets have filled wards with frail elderly people who can't leave until the right support is organised. But as hospitals try to free up beds, some are failing in their duty to ensure each and every patient is able to go home. Catherine Jones, 5 News.